Hi, this is Christy Mendoza from South Bay Total Health and actually from my house today. So, we're dealing with this COVID crisis and we're using modern medicine. We're looking at herbalism, and today I'm going to bring you some really, really old school medicine. This is plague style medicine, air fumigation. I don't even know how old it is, but it's super, super old. However, there is some science to definitely back it up. I know my Monty Python fans out there, maybe you guys remember the whole bring out your dead, and then they have the smoke, and you see the plague doctors. Well, there's actually some wisdom in that. And what I mean by that is, in one hospital, the Chinese were looking into air fumigation in the maternity wards to see if they could use that instead of using harsh chemicals for the mothers and babies. And what they found was that one herb in particular, when burned, had the same effect as UV light sterilization for reducing the bacterial load in the air. So that's super, super cool. Well, so I've been doing a lot of research. So if you don't know, Chinese medicine has just been killing it with COVID over in China. 90% of the patients are on Chinese medicine. The results are good. They're reducing phlegm, shortness of breath, fever. I mean, cold and flu is like my thing. I love it. I know how well our medicine works for things like this. So I'm paying very close attention to all the research and the data coming out, and they're doing a great job. So in some obscurities, I saw that there was some fumigation recipes, and I had learned fumigation a few years ago, and I thought, wow, that's really, really cool. So I said, you know what? I got those recipes, I had them made, and I have them here. So a lot of my patients, I was just like, here, buy this, take this, and I didn't explain. So this video is for you guys who have this to explain to you how to use it. So number one, it's the same formula, but we're going to use it 3 ways. This is it right here. And this has that one herb in it that I said is equal to UV light sterilization, but it also has other herbs that are more particular to this virus. So this is my necklace that I wear when I'm out and about. And what it has in it is it has the herbs in it. Actually, this is the old version. Now we have tea bags in it, which is actually a lot better. So when I'm out in public, I wear my necklace. I want it to kind of be a little bit closer so that it's creating like this little field here. So of course I'm also going to have my mask, right? We're going to double it up. We're going to double it up because we believe that it's modern and ancient together are a beautiful fit. Okay, so that's one way, which is when you're out and about, you're gonna wear this. Now, let's say someone in your house gets the virus. Now we have to clear the air and keep that viral load down so that we can go into their room. So before I closed the clinic, what I was doing is I was doing air fumigation in the rooms because I didn't know who had it or who didn't, and we had one patient go in and then the next patient go in, so we would do air fumigation for 30 minutes in between patients, and then we'd have it rolling like this, constantly clearing the air. So I'm going to show you how to use that. So one way is we're going to get our little Mexican herb burner here. You're going to get some of your herbs, put it in your burner. You can use an incense burner, right? Then you just light it. And this burns really, really good. I got a little long neck lighter from the 99. See? Whew. So what you do, I know you guys saw that thing all over the internet about sage. Well, when I was teaching my cold and flu class, which I teach every year for like 8 years, I couldn't find any data that supported it. But what I did find was the same exact numbers that were circulating on the internet about an Ayurvedic formula that is also used for fumigation. So I don't deny that sage probably definitely, I love sage and I believe in it, but also, you know, there's some spiritual and traditional things about it, which is if it's not your culture, you shouldn't be using it, because there is right now an over harvesting and a shortage. But there's a lot of other herbs that have great function. So anyway, what you do to do fumigation is you're going to get this burning, close off all the windows. You're going to, that room that patient is in, you're going to seal it off, close everything, and you're going to get this burning for like 30 minutes. Smoke it out, and that's going to reduce the viral and bacterial load in the air. Okay, so that's one way to use it. Now, what I've been thinking though is we've been talking a lot about how do we clean our masks, because we know heat kills this virus. And we don't want to, you know, I've seen that alcohol will degrade the pores, and all of these masks are supposed to be disposable, but right now we have to reuse them because we don't have. So what about steaming my mask? Or this way, right? Anyway, that's an idea. It's just a Christy-ism I was thinking about. So how do I do this? Now this is the same thing. This is the same herbal formula, but it's being steamed. So what I did is I got a tea bag. I filled my tea bag, not too much actually, it doesn't really need that much, dropped it in and let it steam. So now this steam is reducing viral load. Now I know you don't have a fancy herb cooker like I do, but I know what you probably do have. A hot plate and a pan. So if you do that, you just could keep it plugged in and cooking in the room and creating that steam, which is, you know, we just make it work, right? Okay, so now here's another way. Let's say, like, this is what we were doing in the clinic, is we were doing the steaming for, you know, 20, 30 minutes. Then we have this rolling, but I only have 2 of these. So another way to do it is that you're gonna pour some of this herbal liquid Okay. And then this is actually a tea warmer. So you just pour it in here. And I found that if you add multiple candles to this little bottom guy, it works pretty good. You can get a little steam on there, but first you're gonna decoct it first on the stove, and then you can move it over this way. So that is the essentials of air fumigation. So sounds pretty good, pretty easy, right? Close up the room, smoke it out, 30 minutes, keep something rolling like this. But look, if you don't have the virus, if nobody in the house has the virus, we have an herb shortage. You're just gonna use this out in public. Maybe you're gonna just take a little bit and you're gonna clean your mask. All right? So for the public at this moment, my friends, family, patients, and class members, if you take my class, I'm gonna try to make this available. So there are herb shortage, but I'm gonna do the best I can and to get this into as many hands as I can. But for my patients that have this is how you do it. All right, thank you very much. This is Christy Mendoza teaching air fumigation.